This is Grace. She has been working as a nurse at an elderly care home for almost 20 years. Grace loves her job. However, she is starting to experience physical discomfort, which affects her job satisfaction. Grace often works with a patient lift, but whenever she moves the lift, she feels pain in her body. She is starting to worry if she will be able to continue her job like this. Unfortunately, Grace is not the only healthcare worker with physical strain. Many care workers experience similar symptoms. Due to the aging population and an increase in the weight of patients, healthcare work is becoming more demanding. Also, sickness absence among healthcare workers remains high. In order to prevent physical overload in the healthcare sector, health and safety guidelines regarding working conditions have been drawn up. These guidelines state that, for example, employees may not apply more than 20 kilograms of force when pushing or pulling with 2 hands. When you're working with one hand, a maximum of 15 kilograms may be applied. But how do you check whether these guidelines are being properly followed? Frequently used methods of measurement are surveys, observations, and spring scales. However, none of these tools measure the actual forces that are exerted in practice. Training courses to learn to use tools correctly can help healthcare workers to reduce physical strain during their work. But are said training courses sufficient? For instance, how do you measure how much force is actually exerted? And how do you find out whether you can work in a healthy fashion with proper training, or if a work situation is simply too demanding? Esense offers a solution which answers these questions and achieves healthy working. The Esense Circular Approach. The circular approach starts out with analyzing the current work situation. With this information, any unhealthy working situation can be detected and subsequently improved. Afterwards, we evaluate whether the goals have been met in the new situation. This completes the circle. The first step is the analysis of the current work situation. We use the Esense ergometer to measure any pushing and pulling forces exerted on the patient lift. Use the handles of the ergometer and work like you normally would. The measurement report provides insight in physical load per employee and indicates how often safety guidelines are exceeded. The second step is the improvement of any work situations in which too much force is exerted. Mobile equipment with Esense Power Assist are equipped with an additional electric drive support, which helps you move the equipment. This way, you don't have to exert too much force by yourself. In the third step, we evaluate the improved situation. With Ergo Feedback, we support you to keep you working within safety guidelines. Flashing LED lights warn you whenever you exert too much force and alert you to the correct usage of the drive support. The Esense Patient Lift also collects information regarding its usage. With the software platform PowerTalk, you can monitor how many times the patient lift has been used in situations that exceed health guidelines. This way, correct use is measured and registered. If you read this data on a regular basis and discuss the results with your team, you promote healthy working within your organization. With the Esense Healthy Working approach, you can detect physically demanding situations and measure them objectively. This way, you can teach yourself and your colleagues with clear and demonstrable feedback to work responsibly within safety guidelines. Thanks to Esense, Grace and many other healthcare workers can continue their work in a healthy and responsible way. Esense. Change heavy to healthy.